Hi guys, welcome back to another Unmask the Title. So today we're kind of putting our dental slash medical hats, or shall I say lab coats on, and we're going to talk about some of the medical topics slash dental topics that are close to our hearts. We're going to be discussing some of the most common questions that we've heard from patients or things that are close to our heart. And we're just going to discuss our own advice and let's see whether we agree with them or not. Let's throw it to Omar first.
Okay. So, as you guys know, I'm a dentist focusing on restorative and cosmetic dentistry. So I have a lot of questions coming from my patients. One of them, and the most famous one, is what is the difference between composite bonding and veneers, ceramic veneers? So composite bonding is very famous in Europe and in the UK, where it's like basically composite fillings, putting them on the front surface of the teeth, and then making them look like perfect or Hollywood smile. Okay? Now, if we compare both treatments, which one is the best? There's no best. It depends on the cases. It depends from patient to patient. But my advice will always go to ceramic veneers, simply because ceramic veneers are more durable, more harder, stronger, and then more natural. Like if you want to do a cosmetic treatment, you always go for something natural, right? So ceramic veneers are more natural. And they don't stain. Ceramics does not stain. Problem with composite bonding is that it gets stains easily. So you need multiple follow-ups throughout the 5 years, which is the longevity of the composite bondings. You need to polish them each 6 months in order to avoid staining. Also, composite bonding are more prone to chipping. Yes, you can repair it easily, unlike the ceramic bonding, ceramic veneers, but it has a risk of fracture. Unlike the ceramic veneers are more stronger. So I think my advice will always be staying very minimal in terms of preparation. Of course, both of them needs preparation. I don't really advise doing composite bonding or ceramic veneers without teeth preparation. So I get also a lot of question asking me, is there any way that we can do Hollywood smile without shaving of teeth or preparation of teeth? I don't really advise this.
Although there are lumineers, as they call it, where
exactly
it's
lumineers actually is something different. We need a whole episode to speak about the difference between composite bonding, ceramic veneers, and lumineers. Lumineers are totally different material. They don't use the normal ceramic material. It's a different material. So, but going back to the preparation subject, I don't really advise non-prep veneers or non-prep composite bonding. Why? Because can you imagine putting veneer on top of the thickness of your tooth? So the thickness of veneer or composite bonding is something around from 0.3 millimeter thickness to 0.5 millimeter thickness. If you're doing this thickness on top of your teeth, you're actually making your teeth more thick and more bulky.
Yeah? So I think it'll sit on your teeth, and then there's the
So it's basically for the sake of the aesthetic of the patient that you're advising them to do minimal shaving of the teeth or preparation of the teeth.
Exactly.
But also the gum health.
Gum health, yeah, that's where I was going to go.
That's the important point. So it's not just the beauty of the veneers after preparation. It's the gum health. Now, what's the issue for putting veneers or composite bonding without preparation is that once you put it without prep, the veneers are sitting on the gum, not sitting on the finish line or the preparation area of the teeth, leading to gaps between the veneer and the tooth. Those gaps are going to be filled with debris, food, and so on, bacteria, leading to bad odor, bad taste, decay, periodontal infection, bleeding, and so on. So to minimize that and to prevent that from happening, we do minimal preparation. Now, this is another subject. Previously, let's say 10 years ago, they used to do a very hard preparation, a lot of preparation. We're talking about a millimeter to a millimeter and a half for the tooth. Exactly. This is gone, and now we're doing something called preventive dentistry, which is or conservative dentistry, which is cutting from 0.3 to 0.4 maximum from the tooth structure, and replacing it with veneers. So, for example, if you're cutting 0.3 or preparing 0.3, you're replacing it with 0.3 thickness of veneers. So it doesn't become bulky.
But I get it from the patients because they say that whenever I want to get rid of the veneers, I just cut it, remove it, and that's it. My tooth is still normal like it was before.
Yeah, so basically, like, I feel like a lot of people, they have this stigma that, oh, the non-prep, the non-shaving one is the healthier one.
Yeah.
Whereas you just explained that actually that's not the healthy option at all.
Exactly.
Because I feel like if you're making that choice of going down the road of any sort of Hollywood smile, as they call it, which is whether composite, ceramic, lumineer, whichever, then you should really stick to it. A lot of people think, it's some sort of, I don't know, like
reversible procedure.
Yeah,
where
they treat it like hair dye.
Yeah.
It's like, okay, today I feel like I'm going to want to have nice teeth. Maybe tomorrow I want to go back to my teeth.
Yeah.
No.
Yeah.
Nail polish.
Nail polish, yes. Even when you go to do gelish or acrylic nails, it will stay for some time and it will damage your nails to some extent. We know this.
True.
We've been through it.
Yeah.
So how do you expect that something you're doing to your teeth, which a lot of people forget, that's an organ of your body.
Yeah.
Then it should be something that you put thought into and make a permanent decision about.
Yeah. Of course, cosmetic procedures, especially for teeth, are not for everyone. Not for every patient. Some patient, they come to me with very beautiful teeth. I mean, there's no spaces. All the teeth are straight. They're kind of yellow, but there are another cosmetic procedures we can do to make them whiter, which is whitening, teeth whitening, instead of just preparing teeth and putting veneers on. But then there are some patients with a lot of fillings in front, chipping of teeth, spaces, malalignment of teeth. So those are the patients who are really looking for something to change their smile. So they go for Hollywood smile, yes, veneers or composite bonding, whatever.
I mean, personally, I know that like a lot of people, especially in certain Middle Eastern countries, they promote composite veneers.
Yeah.
And a lot of people think that it's promoted for, because it's good for you.
Exactly.
Sorry to break it to you, that's not the case. It's mostly because it's cheaper for the clinic, for the dentist to do, because ceramic is something that is not cheap by any means.
And it goes through the laboratory.
Yeah,
and
it's
the
not
lab makes
exactly.
By the way,
that's
it's
exactly
harder for the
reason.
dentist.
Exactly. So
it takes a lot of time.
that's the thing. Doing composite bonding or composite veneers or laminates, whichever terminology some people use, it's easier to do. You don't necessarily need any special courses for it. You don't need any special material for it. It's the same material as the normal dental filling.
True.
And it's easy for them to do it right then and there.
Yeah.
So yes, it's time effective, whatever. But as you said, there's so many reasons why you shouldn't do it.
Yep.
So if someone's coming and telling you, oh no, composite is better for you, think twice. Go research about it. We're not saying, oh, come to Omar and do your veneers with him, but just do your research.
You need to, I think wrap up the advice is, sorry to wrap it up for you.
It's all right.
I think one, if you are looking to do any cosmetic procedure, would be to go for a dentist who is a fan of or who believes in recent research. He's up to date. Secondly, he is up for minimal preparation.
True.
Minimal preparation, although it sounds simple, is not simple whatsoever. You require microscopes, you require dental loops to be able to prepare delicately. So a dentist who prepares delicately is the one you should be going for. And again, the one that is up to date with current research. I think that's
the
really
nicer way to put
yeah.
it.
I think that's pretty much it. Yeah.
Yeah. Any other questions you get often from your patients?
Well, the other question is, what's the difference between veneer and a crown? And if I want to go for veneers and I have 2-3 crowns, will they look the same or will they look different than veneers? Now, first of all, the difference between veneers and crowns is that veneers is only covers the front surface of the tooth and it doesn't cover the whole tooth. Crown, on the other hand, is covering the whole tooth. Now, before explaining further, why do we do crowns? We do crowns only after root canal treatment. And in some cases, for a very big filling on the tooth, then we have to turn it into a crown. Because then if we place veneer, then we might have a risk of chipping or breaking of the tooth. Okay? But especially after root canal treatment, we do crown to protect the tooth. Because if we do root canal treatment, then we are cutting off the blood supply to the tooth. So the tooth gets dry. When it gets dry, it's more brittle. So it's more
and all the
to
preparation you're going through with the dental drill, you're basically hollowing in the tooth. You're like,
exactly.
It's like two pillars where you're like breaking through it and you're making it more brittle.
So there are some patients who ask me if they can do crowns instead of veneers.
So
because
like
all their teeth for crowns instead of veneers, because they believe that crowns, since it covers the whole tooth, it's stronger than veneers. The answer is definitely no, because when we prepare for crown, we're actually cutting 60% of the tooth structure. So what's remaining is only 40%. Those 40% makes the pulp or the nerve of the tooth irritated. When the nerve is irritated, then we have another problem.
Yeah.
It's either going to heal by its own or it turns into pulpitis, which is the nerve is now damaged and we need to do root canal treatment.
So it's like you're opening a can of worms by going down that route.
So we don't want to go to that road, right? So we always go conservative. We do veneers. Veneers can last from 10 to 15 years. And then only after that, we come, if we want to replace the veneers, we will replace them. And if there are some teeth that needs further work, we will turn them into crowns. Okay.
Okay. And what about the matching?
The matching. The advancement in ceramics is that the technician nowadays can do exactly similar shape of a crown to veneers. So I have some cases that I have 2 front teeth One of them is Emax, which is ceramic veneer, and the other one is a crown. And that crown is from a different material, which is zirconia. Okay.
Wow.
And both of them, they look exactly the same from the front surface. So yes, we can do crowns that look exactly like veneer, but they covers the whole tooth. That's the whole point.
Nice. So essentially, like, no, you don't need to cover your entire tooth to match your
Of
other
course,
crowns.
Of course.
Yeah.
Right.
Anything else?
I think this was everything.
The
Top
most
questions.
important
top
questions, yeah.
questions. Yeah, the rest are just
Trivial,
very simple, normal questions.
Yeah.
Okay. Who wants to go next?
I will do.
Yeah,
Yalla.
go ahead.
Okay. So the most common questions that comes to me is through pregnant ladies. So basically, what they ask is that the first step, is it safe to come to a dentist while she's pregnant? It's safe to come, and it's mandatory to go to a dentist for the whole pregnancy, but there is like a specific time that you can do the treatment. For the first 3 months, which is the first trimester, we don't usually like tell the patient to do any elective treatment. It should be an emergency treatment, and it should be like highly like
It's emergency in terms of
Urgent.
yani, she
Highly
needs to
urgent,
do
yeah.
it. She's in pain.
yes.
She needs to get that done.
Yes,
yeah.
exactly. That's an emergency. So, but elective ones like the cosmetic
Yeah.
veneers,
Yeah.
there is no need for this one in the
Of
first
course.
and the third trimester.
Mm.
The second trimester is the safest trimester to do any treatment, okay? And for the whole pregnancy thing, the whole 9 months, they can do scaling and polishing, which is cleaning for the teeth.
Right.
This is number one.
Can I stop you here?
Yeah.
It's very important to mention that pregnant ladies should go for cleaning,
Yeah.
Yes,
especially during pregnancy.
I'm going to this thing because I have another question.
Exactly.
Yeah. So the other question is, does pregnancy affect teeth? Okay. So here comes the hormonal changes that happen to the pregnant lady actually affect their gums. They don't affect the teeth themselves, because some of them, they think that I'm giving calcium to the baby, so it's taking the calcium of my teeth. So it's not necessarily to be that, because the calcium that you have in your teeth, it won't be gone. But anyways, taking care of your oral hygiene in general, it's very important during pregnancy. For the hormonal changes that happen and change the gum, it will be a bit more inflamed or looks more reddish color, more inflamed. That's why we need to take more care in pregnancy to clean the teeth, clean the gums, and plus we need to cover something that the pregnant woman, other than getting fat or like gaining weight, she should lower her sugar intake. So it's better for the teeth and better for her health.
Actually, on that note, there is even like research that has proven that pregnant women do end up with a special type of diabetes,
True.
gestational diabetes.
Yeah.
So that is like, you hit like a very important note with that.
Yeah.
I mean, I understand what we all know with hormonal changes, not necessarily even just pregnancy, but obviously more so in pregnancy, women tend to crave sugary things. So it like goes hand in hand. There's the hormonal changes, there's the sugar intake, and then you craving random food at all random hours of the night. You really, really need to take care. And there are women that I believe they do take care, but it's just because of their body's reaction, they still do end up with those inflamed, super inflamed gums. That's why they should go to the dentist.
Exactly.
Because the way that the dentist can clean and polish your teeth, no toothbrush, no water pick, no floss can do that
do
at
the
home.
same job.
But
Yeah.
still, for their usual routine,
They should.
they need to brush twice daily, floss, mouthwash, because it's
Yeah, of
necessary.
course. Of
And
course.
to add to that, I think one of the other important things, maybe, you know, we say it's important, but maybe they don't understand the importance of it, the magnitude of it, is that once you have the inflamed gums, that can lead to gum disease and then periodontitis, which is the inflammation of the surrounding tooth structures of your teeth. And then that inflammation can also go systemic into your body and lead to
Other infections.
other infections and issues to the baby.
Yes.
Yeah.
true.
So it's a whole cycle that is not just like simple, like, oh, okay, you know what, I'll just wait after pregnancy and go get the cleaning done. No, like that's a sacred 9 months that you need to take care. And oral hygiene, you might think it's a very small area of your body. I mean, it leads to everywhere.
Yeah.
True.
Literally, it's like it's
True.
literally the first step. It's-
Yeah, exactly.
Leads
So
to
some
everywhere.
patients, they come, they say, I have a headache, and the headache comes still here. And then whenever you open his teeth for checkup, you see, oh my God, there is like a huge cavity.
Yeah, it's a huge decay, and that headache is coming from the teeth.
Yeah.
Yeah.
I'm not gonna lie. I mean, some people are calling us pseudo dentists, or no, pseudo doctors.
Yeah.
And little do they know that the headache that a GP might not be able to detect,
A dentist
The
will.
dentist will.
Dentist can. Yeah.
On that note, I
Yeah.
must
Yes.
point
You
this
just
out.
triggered.
You triggered Yalda.
her best friend is her biggest trigger point.
Yeah, I know.
Yeah,
Just
my
like a
best friend always says this. You're not a doctor. FYI, FYI. Please note this.
Just calm down, Yalda. Okay, it's okay.
Dentists, we actually have to study basics of general medicine.
That's true.
However, general doctors do not study anything
Anything
about
related.
dentistry.
The
Maybe,
10%.
maybe.
10%.
No,
not
they
only
just know how
10%.
many teeth we have.
Yes, and maybe, just maybe, in some universities, they teach them the name of the teeth.
Yes.
And maybe if they specialize in surgery
Yeah,
and
that's something
eventually
else.
into maxillofacial surgery, then yes, they might know more about dental things, but not necessarily to a dentist level,
True.
because they will know about the nerves and stuff.
Look, let's
I mean,
let's
here,
not
it's
let's not
a
open.
different topic, all right?
Let's not.
We're not saying that dentists are better than
No,
doctors,
I'm not saying
but
anyone's better. I'm not saying anyone's
Yeah,
better.
because
Yeah. No,
people, they
even-
need both.
Even better or worse, no. Let's just not open a can of worms here and put ourselves in
I'm
a
just
rabbit
saying
hole.
we're not pseudo doctors.
Yes. Yeah.
Dentists are doctors, and as
We
far
have sufficient amount of knowledge
Yeah.
to be able to correlate and diagnose
and
even
refer.
yes.
Which is
even
important.
systemic issues.
Yes.
Yeah.
Not
Like-
just oral cavity related.
Yes.
Exactly. Like, we know if a pregnant woman comes to us and we can tell that there are signs that maybe she's having too much sugar,
Yeah.
then we need to refer her to a correct doctor for that, for diabetes.
Which doctor would that be?
Well, considering she should have an OBGYN, she can consult with her OBGYN.
I'll give you that.
Exactly.
Nice.
Gynecologist.
Yeah.
Yeah.
But yeah. Okay, so let's go back to Fatima. Rant over.
It's fine. Okay,
She
so
forgot her second advice. خلاص.
no,
Third,
it
third.
was third.
Oh,
She's counting with me.
nice.
It's woman.
I got you.
So okay, the third one is that after all that we just talked about, some of them, they just ask, is it safe for a pregnant lady to go do a treatment?
Mm.
So yeah, it's 100% safe within the things that we said, which is the first, second, third trimester for the cleaning. If we need to take an x-ray, of course, she should tell the dentist that she's going to that I'm pregnant, so we should take more care of her.
Mm.
we studied the position, how we should position her to make her feel relaxed.
Comfortable.
Yeah, and for the X-ray, we usually put a lead apron to protect the baby and the mother, and also the
Thyroid collar.
And yeah, so it's safe.
So I'll add on to the lead apron and thyroid collar. Now, if you're a dentist, let's say you're pregnant and you go to the dentist, and for whatever reason, for a simple X-ray, what we call as intraoral X-rays, which is the bite wing or the IOPA.
AKA the one that they put inside your mouth and you hold it or something.
Yeah.
like that.
Now those ones, I believe nowadays the dosage of X-ray is so minimal and so little that
doesn't
the lead
affect.
apron and the thyroid
Is
collar
not
is not necessary.
Yeah.
But some dentists have the school of thought that better safe than sorry.
Yeah, exactly.
Later on, look, I put the lead apron. I'm not going to be blamed for anything that happens to the baby.
Yeah.
But for OPG, CBCT and stuff, yeah, definitely.
Yeah,
like
of
if those call for those
Even
X-rays.
recently, like they did a very nice research about that, about X-rays and whether to put lead apron or
No.
thyroid collar or not, and they finalized that the dental X-ray, which is the intraoral X-ray, you said. It's very safe to do it without lead apron, so it's totally fine.
I think it's the fear factor
it's
from
just
the
the
from the
Yes.
dentist.
Yes,
That like, look, I just want to be on the safe side. I don't want to have any cases filed against me later on. Here's the lead apron.
exactly.
You
I'm
do
No,
it.
actually, there are some patients who asks for
Yes, true.
lead apron
Yeah.
and thyroid collar for the intraoral.
I mean, there
X-ray.
are-
I mean, it's not necessary, so it's fine if you do it without it.
Yeah.
And again, if you put it, it's not bad.
For
I mean, it's not
general
gonna-
public, I
yeah.
mean, the to give you a comparison of how safe intraoral X-rays are, I mean, the amount of dosage of radiation you get when you're outdoors under the sun is more than the amount of radiation you get from the
Exactly.
intraoral.
People don't understand this.
Yes.
Yeah.
So if you explain this to the patient, he wouldn't believe you.
Yeah, he'll
trust
be
me.
like,
Yeah.
you just don't want to
And
give
some
me
people,
the
Yeah,
they
exactly.
will fight, you know?
Yeah.
They
That's
would be
why.
like, you want to hurt me.
Yeah, yeah. So
That's why, like, if the person seems like they're the type that, no, they like to fight you or something, just give them the apron.
Yeah.
Yeah.
Anyway, all facilities have to have it, so you
Yeah,
might as well
exactly.
give it to them.
Yeah.
Okay, so that's it.
Moving to the last one, like a smaller one, because we just talked about pregnant ladies.
Yeah.
So moving after pregnancy, we have kids.
Yes.
So the last, like, most common question was like, the baby teeth, do we need to clean it well? Do they affect the permanent teeth? So yes, of course it affects, because basically taking care of the oral health of the baby, starting from the first minute that the first tooth comes out, you need to take care. You need to teach your child how to brush that tooth. So after, when he will be older, at least he knows.
has the habit.
Yeah, exactly. Because I see a lot of children now, they don't know how to brush their teeth.
Yeah.
So, and those primary teeth, they affect the permanent teeth if it get like
Decay or infection.
decays, infections. It goes to the permanent teeth. So why damage both? Just take care of both. Lower sugar intake for the baby. No need to have like chips or chocolate snacks. Let's give them like healthier snacks, vegetables, fruits. It's also sugar, but
Much lower dosage and it's the
Healthier
healthier
sugar.
yeah,
version,
exactly. And at the same time, you're not introducing your baby for those things to make him fall in love with them, so later he will ask.
Yep.
True.
And that's
I
it
must
for me.
add something to this. I think a lot of parents thinks that, okay, this is a primary teeth
Yeah,
or
they will
milk
fall
teeth.
out.
They will fall out. We don't need to do dental procedure or
True.
treatment to those teeth, and they will just fall out, and then new
We get
teeth
new
will come.
ones.
Yeah.
We're not alligators or sharks.
Yes. I must say that we have a dental specialty, which is pediatric dentists, okay, specialized in treating children. So, I mean, if it was not necessary, we wouldn't have dental specialty as pediatric dentistry,
True.
right? It's very important because if you neglect treating your child or the teeth of your child, he will have a lot of problems with his permanent teeth.
Yeah.
So it's very important. And on that note, I have a special guest who is a pediatric dentist who will come in one of our episodes.
For sure.
And
Yeah.
we will definitely ask him about this.
Yeah,
for
because
sure.
I think it would help for, obviously we can explain it to some extent, but it would be lovely to have him explain it further in
course.
detail.
Yeah, exactly. That's why I didn't
Exactly.
went inside.
Yeah, like, but for people, just so you can kind of imagine, it's not like when these teeth fall out magically another one appears.
Yeah.
There is a whole process, and
Yeah.
those all, like the more permanent teeth, are forming
Yeah.
Yeah.
essentially.
It's the
Forming underneath.
Underneath,
Yeah,
It's
exactly.
very important.
Underneath
So
the milk
whatever
teeth.
whatever infection you have on the primary tooth,
It's,
It's
gonna
transferring.
Transfer,
it's
yeah.
gonna go down there
Exactly.
or up there.
yeah,
You know, so yeah, very, very valid point. I think honestly, as moms or even dads, that the things you talked about is so essential for them to know, because I mean we've all worked on pediatric patients, that
One
children,
of my
Yeah.
least favorite
one of my
specialties.
most favorite, but it's like these are literally the questions they ask a lot, and obviously it all boils down to the fact that this sort of knowledge is not available out there. Not
Yeah.
that many people know the importance of it.
Yeah.
So I'm really glad you talked about it.
Mm.
Thank you.
Now let's jump a little bit of a mix of medical plus dental with Yalda.
Okay.
So I really love things that are kind of relating medicine and dentistry.
Mm-hmm.
In case you couldn't tell from my rant earlier.
We can't.
She was gonna throw a tantrum here.
Exactly.
I
You
have
better-
no sleeves, but I'm rolling them off.
You better call me a doctor.
I did not study those many years for you to call me pseudo doctor. But I feel like there are certain very, very important questions that I used to hear from patients that we used to see in the hospital.
Mm-hmm.
And like we used to get some patients that were worried about things like cancer.
Mm-hmm.
So mine are a little bit more serious, I
Yeah.
guess.
Yeah.
So the first question is, can cancer weaken my teeth? And I'm not talking about oral cancer, I'm talking about general cancer.
Mhm.
And the answer to that is, cancer itself may not weaken your teeth.
Mhm.
However, the treatment of cancer
Mm-hmm.
can affect you.
That's true.
And again, so any type of treatment that you do, whether it's medicine that you're taking orally, IV, anything, generally works on your entire body system. So when it comes to cancer treatment, obviously cancer is a very severe disease that can take over your whole body. And most of the treatments that are currently available, other than surgery, are targeting your entire body.
Mm-hmm.
As much as they may try to target it to whatever area it is
Specific
affecting
area
you.
in the body. Yeah.
Yeah. But generally, it does go into your entire body system. So chemotherapy and radiotherapy, radiation, these are the main two treatment options. They have a lot of complications that can come after
Mm-hmm.
to your mouth. So it's not that you had cancer, now you have gum issues or dental issues. It's the treatment you will eventually do for the cancer that might affect you. Basically, the blood supply and the salivary glands, which is where the water in the mouth and all that comes from, are the ones that get affected. So with chemotherapy, the three most common things that happen is you get ulcers, inflammation. It can increase the bleeding. Like, for example, the tiniest prick to the gums, it can bleed.
Yeah.
And it can cause nerve damage. Our mouth, this area is full of nerves, full of essential nerves. So any damage to them can cause a whole cascade of issues.
Yeah.
And then with radiotherapy, you can get fibrosis. So, like, for instance, what that happens is that you may, God forbid, if you're going through this, you may experience that you will have limited opening of your lips, which will affect how you can brush.
Yeah.
And then you can experience more decay and cavities because radiotherapy reduces the water supply, the salivary, causes xerostomia. And it can also affect the bone around the teeth.
Yeah.
So if the bone is going through a breakdown, your teeth are going to become loose if they already have some degree of bone loss. So that's why generally anyone, let's say, God forbid, you've just been diagnosed with any type of cancer. Before you start any sort of cancer treatment that includes chemotherapy and radiotherapy, which generally comes with most treatment options, you must go for a full comprehensive dental checkup before your cancer treatment.
Yeah.
So in that case, the dentist should be informed of your current status, and that dentist is responsible to make sure that you do all sort of dental treatment that you require before you proceed with chemo or radiotherapy.
True.
Especially if it's anything that's surgical. If you need extractions, if a tooth is questionable. Normally when a tooth is questionable, as dentists, we try to preserve it.
To save it, yeah.
Yeah, we'll do root canal, we'll do this, we'll do that. If a patient we know is going to go and have radio or chemotherapy, the best option is extraction.
Absolutely right. Yeah.
Don't extract and tell them, okay, do implant later. No. Go ahead and do A to Z before chemo and radiotherapy.
Yeah.
Why? Because they're going to have damage to their blood supply, nerve supply, which means any implant surgery later on will most likely fail.
Yeah.
So that's the number one thing, the effect of cancer treatments for me. A bit heavy. I don't know if anyone wants to jump in on that. But
I mean, you've touched up on all the points that are related to cancer and teeth, so I wouldn't really want to add anything to it. It's comprehensive enough.
Yeah, I think it's just more of like, we need to make sure that the general doctors as well are informed about this.
Yeah, I think God forbid you have cancer, don't forget about your teeth.
Yeah.
I know cancer can be something that can cause turmoil. It can cause a lot of other issues, and then you'll just forget about everything else, and your main focus is about the cancer itself and the site at which that's found, and so on and so forth, and you just forget about your teeth, you forget about the oral cavity. Then you're now going to have to deal with the cancer plus the oral cavity.
True.
Plus you're undergoing the treatment, so you can't stop the chemotherapy and radiotherapy. Now you have issues that you're going to have to deal with your oral cavity. Why? Because you've neglected it. So I think just don't neglect it.
Actually, now that you mentioned that, I remembered something, which is sometimes when people who are going through chemo or radiotherapy, if they do visit their dentist often, sometimes the dentist can notice severe complications.
That's true.
And the dentist should be constantly in contact with their physician. Yes, sorry. They should be in touch with their oncologist. There we go.
There you go.
And they should communicate so that they can adjust the dosage or the type of treatment that the patient is going under for their cancer, if it's causing severe oral issues. Oh, and they can also sometimes experience yeast infections.
Yeah.
That's another one I forgot. So yeah, that's the number one. Number two is something that I noticed personally with some patients was, you know, when we get a patient, especially a new patient, we have to ask them a certain number of questions.
Yeah.
One of those questions is, what medication are you taking?
Mm-hmm.
And a lot of them are like, I'm just here for my teeth. Why do you care what medication I'm taking?
True.
We care because it affects you in so many ways. And so you might ask, how does my medication affect me? Again, it goes back to the concept that it affects your entire body system when you take any sort of medication. Generally, most of the effect, we notice it in the gums, not necessarily the teeth. And a lot of the time, some of the most common ones, they cause huge inflammations of the gums.
Yeah.
So the three top ones that do cause inflammation are medication for seizures, which is the phenytoins or anticonvulsants, and then calcium channel blockers, which is people, they take it for high blood pressure or hypertension. And then anyone that's going through any sort of transplant or cancer treatment or whatever else, whoever's taking cyclosporin or any type of immunosuppressant. These three cause like excessive enlargement of the gums. So sometimes people, they just think, oh, this person must not be brushing. No, it's got nothing to do with oral hygiene. It's actually their medication.
Yeah.
So that's why the relationship between the dentist and whatever physician they're seeing is so important and so crucial, so that they can communicate and they can let each other know that, hey, can we maybe change the type of medication this patient is taking? Because everything is reversible. Even that enlargement, okay, change of the medication, possibly periosurgery, more regular scaling and polishing, they can help.
Yeah.
And funny enough, one medication that can maybe help you in terms of your oral hygiene is diabetes medication. Because obviously that's a whole huge topic. Diabetes and oral health are very, very interlinked. So if you're controlling your diabetes, you could be controlling your oral disease, which is your gum disease. So it's not always a negative thing.
Interjecting over there, I think one thing that you don't necessarily easily find online, or it's not really talked about, women who are taking oral contraceptives and then your dentist is, for example, prescribing you an antibiotic, and you know that you're on oral contraceptives for whatever reason. Antibiotics and oral contraceptives counteract each other.
Yeah.
Okay, so like one time, one of our professors was telling us about the story where the lady was pregnant, even though she was taking oral contraceptives, and he was basically the ethics doctor, and he was telling us about the situation where the lady comes and says, well, I'm taking oral contraceptives and I'm pregnant.
I'm pregnant, yeah.
Although oral contraceptives are not 100%, it's not going to give you that 100% safety net. But yet again, he was saying that a dentist prescribed antibiotics, counteracted it. So oral contraceptives is out of the equation. Antibiotics is not working, so she's now pregnant. So
pregnant with a bacterial infection.
So that's also super important for any women taking oral contraceptives for whatever reason, or the other way around. Need to be informed of that. I think that's one.
So we always ask the patient that if they take any kind of medication or do they have any kind of disease.
Sometimes sometimes, oral contraceptives, I think, is like a daily thing. So it becomes like a part of their
daily routine. Yeah.
So they don't even remember that, okay, I'm taking this medicine.
Exactly. So they don't even vocalize it. So I think
I usually ask them specifically on this, especially when I know that the
it's a married woman,
or she has a boyfriend or something like that. So I specifically ask for this. Do you take oral contraceptive?
Yeah.
Because a lot of them forget.
They don't know. Yeah, they don't know, or they forget to even mention it. They'll tell you about their ibuprofen that they're taking, or the Panadol they took in the morning,
because it's for headache, and that's it.
Yeah.
And talking about what Hamid just said about the medication, it's also some of the medication that a pregnant woman, she takes, it affects and go to the baby, and then when the baby has the teeth, you can see like
the effects of it.
abnormal colors or abnormal
Yes.
things that happen to the
That
teeth.
is so true. That's like there are
Tetracycline.
certain antibiotics that if you're taking them, it will affect the teeth of your children.
Yeah,
Yeah.
exactly.
It causes internal stains.
Yeah. And then I have just one last one, quick one, which is, does smoking cause oral cancer? Yes and no. Smoking is not a cause, but it's one of the most important
Cofactor.
cofactors. Alcohol and smoking. And I think that's a huge topic we'll get into later, but just so everyone knows, yes, it can be a very
Can
important
lead
factor.
to, yes.
So
Yeah.
stop smoking.
I'm not smoking, but
No, I mean,
others.
I think the stuff that I'm talking about is more on the medical side, has nothing to do with dental, and is quite close to my heart. It's about asthma and color blindness. So now I have asthma, and I was born with asthma, and it's pretty much genetics, hereditary, as they call it. So one of the most common question that I get is, okay, so I mean, you're now 20 plus years old, so you should have no asthma. It gets cured, right? After 15 years old or whatever, at the age of 15. No, asthma is not curable. It's just about the management of asthma, because the lung capacity is what it is. I mean, it's not going to grow more than that, but through endurance training, through exercise, through a bunch of different management measures, plus medication, yeah, I mean, you can manage it. It pretty much becomes to a point where it's almost cured. I did face that at the age of, let's say, 15 to 18, where I literally had no asthma. There was nothing. I could run, I could play football, I could play basketball, I could sprint, do whatever I wanted. Not a single attack. But I don't know what happened. Again, it came back stronger than ever. And I mean, I was still gymming, I was still pretty fit, and it came back stronger, and it's gonna stay for the rest of my life. So question is, yes, it's no, it's not curable, and yes, you can manage it. And yeah, I mean, if you have asthma, number one advice would be exercise. And I don't do that enough myself.
I've been trying to get him to.
Yeah.
No amount of medication can get you better. If you exercise, it's going away, almost 90%. The other one is asthma preventable? So as I mentioned, it's genetics, it's hereditary. You're gonna be born with it, pretty much from your bloodline. I mean, your mom, dad, whatever. So it's not preventable. But again, there are measures where you can take in order to, stop the attacks. And funny enough, like, you can also get asthma in your adulthood. You don't have to be pretty much born with it, but you can get.
Like, you're born with it is hereditary. It's there, but
it's
it gets
there,
triggered.
But it's triggered. Yeah,
later
it's
on.
like you wake up those attacks later in life. And then the third one for me is not an advice per se, but since I'm colorblind, and it's not, you're not black and white, just FYI, when I say colorblind, you all are colored. Okay?
Okay, that came out wrong.
I can see color. Okay, everything is colored. All right, but I'm a specific type, which is called red-green color blindness. Now, I discovered this when I was actually getting my driver's license. So 18 years of my life, I had no idea I'm colorblind. I show up to the optician and optic shop. Okay, he opens this book and it's a book, bunch of colors in there. Maybe we'll put up a photo or a few of them on the screen for you guys to test your color blindness. He opens the book And he's like, what number do you see on the page? And I'm looking at him like, what number are you talking about? It's just colors. There are no numbers. And he's like, what do you mean there are no numbers? There are numbers here. I'm like, well, there are no numbers. He flips. He's like, okay, what about the number here? I'm like, well, there's no number here. It's just colors. So there are two types of red-green color blindness. Okay, there's a type where you see more intense green and less light. Okay, or vice versa. Okay, so it's either affecting the red or the green. Okay, so I have both. I'm blessed with both. I see intense greens, and I see greens that look a little bit red, and I see reds that are a little bit green. So it's like a mix.
So what color is
You
this?
just discovered this
What
now.
color is this? This is orange. Okay. So as I said, I'm not colorblind.
Not
I
fully, like not fully colorblind,
Yeah.
but you are colorblind.
I am colorblind, but so the things that I can't do is basically I can't be a pilot.
Yeah.
Okay.
Good thing you're a dentist.
Yeah. Funny enough, I mean,
You can't see caries?
funny. No, but red-green colorblindness is like one of the least severe ones.
Yeah.
It's quite common, and you actually get it through your mom, but your mom herself is not colorblind. So it's a recessive type of gene that goes through your mom to you.
She's a carrier.
Yes, exactly. She's a carrier.
So question,
Tell me.
right now those green leaves.
Yeah.
I'm not asking you whether you can see them. I know you
Look,
can see
I
them.
probably-
After 5 years, I know you can see them.
I probably won't be able to describe the same green as you can.
Yes, that's
you know?
exactly where I
That-
was gonna go
It's
with
like
it.
Yeah.
I think that green is super intense to me and has hues of red in it. All right.
That's what I wanted to ask. So like you see a bit of red in that green?
Not gonna lie, Yanni. I think when they talk technically, theoretically, when they say that,
I mean, you have a
sitting at-
different definition of red and green.
Exactly. So when I sit and look at something green, I'm like, oh, I don't really see a hue of red in there. I just see green. So yeah, I can see color, guys.
Good.
But
Great.
a colorblind person who can see color.
Yeah.
Yeah.
And I
We're
think
glad.
Great.
that's pretty much it. I don't have any dental advice. You
think
guys
we
have
covered,
you've covered pretty much everything in
most
it.
of
Yeah.
most of
Yeah.
it. Yeah.
Major topics.
Yeah.
I think with that,
Yeah.
we should wrap it.
Yeah.
And if you have any questions that are medical, dental, please write them in the comments below on whatever platform you're on, and we will try to answer them in an upcoming video for sure. And if we said something that you think we're wrong, please do feel free to share your thoughts on it.
Of course.
Okay?
We would love a debate. Yalda will answer all of them.
Yes.
Of course. She will be the one to answer.
I will be
all of
here.
them.
I'll be the one fighting.
Thank you. I appreciate it.
You're welcome.
And so don't forget, drop a like, subscribe, follow us on whatever platform you're listening on. We are on all the platforms you can think of: Spotify, Apple Podcasts, YouTube, TikTok, Snapchat, Insta.
Facebook.
We're everywhere.
Threads. Don't forget that.
Threads.
Exactly.
We do be threading.
Yeah.
Yeah, we're everywhere. So drop a like, comment, subscribe, follow, whatever. Yeah, and see you guys in the next one.
See you.
Bye bye.
Bye-bye. That was the most synchronized bye-bye we've ever said.